Breaking news on the royal family today. Buckingham Palace says the king has sought treatment for an enlarged prostate. The palace releasing a statement a short time ago saying the condition is benign. The king is expected to be admitted to hospital next week for a corrective procedure. Now, this statement coming just a short time after we learned Kate, the Princess of Wales, had undergone abdominal surgery. Let's bring in Afua Hagan, our CTV royal commentator. Afua, thank you for joining us today. It's quite the news coming out of England right now.
Yes, quite the news, quite the afternoon we've had. Of course, we had the statement about Catherine, the Princess of Wales, and her hospital stay for 10 to 14 days recovering from abdominal surgery. She will be out of action until after Easter. And then about 2 hours later, we had the statement from Buckingham Palace regarding the health of King Charles III. Now, he is to undergo prostate surgery. That's surgery for an enlarged prostate. It is benign. So in both instances, the palaces have wanted us to know that cancer is not being mentioned in either of these health diagnoses. It is benign, and he will be postponing engagements in the next couple of days. He was supposed to have events at Dumfries House up in Scotland on Thursday and Friday. Those have been postponed upon the advice of his doctor, and he will be recuperating for a few days afterwards into next week as well. And it's thought that King Charles III was keen for people to know about this diagnosis because he wanted to raise awareness for this condition, which is quite common in men over the age of 50. So like we said, this is benign. He will attend hospital for an operation early next week and will be recuperating at home afterwards.
It is good to see, actually, that the king is talking about it. Men often struggle with getting treatment, don't they?
Absolutely. You know, it's great that in this time of, which must be a stressful time for him and his wife and his family, that he is thinking about raising awareness for these kind of conditions, and especially when it comes to men's health. You know, we know how difficult it can be to get men to go to the doctor to be treated for physical or mental health conditions. So it's good that he decided to make part of his condition public so that he can help raise that awareness. And in fact, this, I think what we're seeing here is, you know, both Buckingham Palace and Kensington Palace in these statements giving us some detail that we probably wouldn't have got, you know, especially when it comes to Catherine, the Princess of Wales. We do not have all the details of her health diagnosis, but we were told the hospital stay, we were told the hospital that she is in, and also that she'll be out of action till after Easter. And she apologized for postponing events and hoping that some of them. Also, when it comes to King Charles, you know, he wanting to raise awareness of this condition, to get men to go and get themselves checked. If that's something positive that can come out of this, then that is a good thing.
And do you recall a time where we had two of the royals, senior royals, off duty at the same time?
And it's actually going to be 3 of our senior royals, because the Prince of Wales has announced that he will also be taking some time out to help his wife recuperate. They do have 3 young children at home. So we are going to see a situation where we have the Prince and Princess of Wales and the King out of action all at the same time, although that will be probably for about, you know, a week, maybe a couple of weeks. But yes, and they're also 3 of the 4 most popular royals in the United Kingdom. So that is going to be unusual for the royal family and unusual for the firm. We could expect to see Princess Anne, the Princess Royal. She's the hardest working royal, always puts in the most engagements every year. We can definitely expect to see her out and about doing investitures that Prince William, the Prince of Wales, was supposed to be taking care of over the next few weeks. And we can probably expect to see the Duke and Duchess of Edinburgh undertaking more royal duties as well to fill in for the Prince and Princess of Wales and, of course, King Charles III.
All right, Afua, thank you very much for that update. We appreciate it.